issues related to DDX3X. And the first one will be about nurses and their care after the patients. Drodzy Państwo, interdyscyplinarna opieka pielęgniarska nad dzieckiem z chorobą rzadką DDX3X. Tutaj magister Barbara Stefaniak. Zapraszam Panią gorąco i ja biję Pani brawo. No pewnie, dziękujemy, że Pani jest. I ja dodam, że jest Pani wiceprzewodniczącą Okręgowej Rady Pielęgniarek i Położnych i jest specjalistką do spraw epidemiologii. W Poznaniu. Tak, i Pani tutaj się urodziła w Poznaniu?
You were born in Poznan too? Yes, of course. Born in here.
O, a to taka atrakcja, bo to rzadko się zdarza. Pani kocha Poznań?
Do you love Poznan?
Tak.
Yes.
Tak?
Yes.
Ale zastanowiła się Pani.
But it took you a second to answer it.
Inne miasta.
Well, because I love some other cities as well.
Pewnie. Będzie Pani dzisiaj na tej kolacji?
Great. Are you
Wieczorem?
going to join us for the dinner
Postaram się.
tonight?
Dobrze.
I will do my
Zapraszam
best.
serdecznie do Pani
Okay,
prezentacji.
so the floor is yours.
Bardzo serdecznie Państwa witam.
I would like to welcome all of you in the Polish language this time.
Bardzo serdecznie podziękować
I would like to thank
pani Professor Moyes i Professor
first of all
Malak za
Professor
przede
Moyes
wszystkim za
and
ich
Professor
wrażliwość
Malak first of
na
all
problemy
for them
dzieci z
being so
niepełnosprawnością.
sensitive to the problems of
ważne,
children
na
with
dzisiejszej
children with
konferencji,
disabilities.
bo wiemy,
It
że
is very
DDX3
important
to
at
choroba
today's conference
przede
because
wszystkim
we
mało
know
znana.
that
I to mieliśmy okazję
DDX3X is a really poorly known disease.
przed przerwą.
So I think
Ja ze
it's
swojej
important
zawodowej
that
strony
there's
chciałabym
more
Państwu
awareness of this
przybliżyć rolę
disease. On my
pielęgniarki
part, I would like to tell you more
opiece
about the
trudnej
role
nad
of a nurse
dzieckiem
during this very
z chorobą
difficult
rzadką,
care over
a
a
w tym
child
wypadku
with a
z
rare
chorobą.
disease, in this case DDX3X. Doesn't work?
Jest dobrze.
Okay, it's fine
Jestem
now.
pielęgniarką epidemiologiczną.
I'm an epidemiology nurse.
Widzę.
And I can see some epidemiology here.
I wystąpienie musi troszeczkę moje zawierać
My
tych
presentation
tematów, więc w 2014
includes
rozpoznano
some issues. So
około 10
diagnosed
dzieci
for the
chorujących
first time in
w Polsce, mylone z
2014, approximately 10
ukierunkowana
children in
na
Poland,
pediatrię,
very often
głównie na
confused with the
dziewczynki.
autism syndrome,
Pracuję w szpitalu
primarily
pediatrycznym, dlatego
considers
ta
girls
pediatria
and
jest mi
primarily
bliższa.
diagnosed
I tak
by
jak tutaj
pediatricians.
Państwo
I
pytacie,
work in a
70%
hospital in Poznan. As you can see here, approximately 70% of cases
chorobujemy się przed drugim
are diagnosed
rokiem
before
życia.
the second year of life.
Wskaźniki są
Epidemiology
nie są wysokie.
indicators are not high, however, the trend is growing, and I know that it has a very negative impact on the healthcare system, and in the future it will pose additionally a great challenge to epidemiology. It incurs big cost to the entire system. We perfectly know how high is the price of genetic screening testing, and of course a growing number of patients will require adjusting the educational methods. What are the children with DDX3X like? How parents describe their children? So we can read and we can hear that they willingly participate in peer group activities. They are very active. They do not show aggressive behavior, which is very important from the perspective of nurses' work. They learn group relationships by watching and then following. What is very nice, they look straight into your eyes and they smile. What the child and the family must cope with, first of all, social or public incomprehension, very often long-term therapies, often involving pain, searching for the diagnosis and treatment on their own, frequent diagnostic and laboratory testing. And of course, we know that it involves some economic loss and also social isolation.
Przygotowanie dziecka
Preparing
do planowej
a
hospitalizacji
child
to
for a
pierwsze z zadań
planned
pielęgniarki
hospitalization
w
is one of the first most
szpitalu,
important
właściwie w
tasks
każdym
of a
szpitalu
nurse in any
pediatrycznym.
hospital, in
Jednak,
fact, any pediatric
wyznaczenie terminu
hospital.
przyjęcia do szpitala w
So
naszej
setting a
w naszych
date for
realiach tutaj
hospital
polskich, to
admission, looking
ustawa
at the
za życiem,
Polish
która nie
reality,
obejmuje
there is
dziecka
this
przed
so-called
diagnozą.
pro-life does
Czyli
not
dopiero po
apply to a
stwierdzonej
child
diagnozie,
before
po stwierdzonej
it or
diagnozie
she
wymaga
has been diagnosed. Only
dodatkowego
after the
dokumentu
child is diagnosed,
potwierdzającego
there must be an additional
niepełnosprawność.
document
To
proving the
wypisuje
disability.
lekarz specjalista
So
lub
it is
lekarz
prescribed by
medycyny
a specialist
rodzinnej.
doctor or family doctor.
Pracuję, jak wspomniałam, w szpitalu
As I
wielkopolskim
said,
Centrum
I've been
Pediatrii w
working at
Poznaniu.
the
Termin
Wielkopolska
planowanego
Pediatric
przyjęcia
Center in
jest
Poznan.
standardowy jak
So
w
the
Polsce,
planned
pół roku
admission
oczekiwania na przyjęcie
date
dziecka.
is like
Mówimy o
half a
dziecku
year.
przed diagnozą.
We are talking about the child
Po
before
otrzymaniu
diagnosis.
terminu oczywiście
After
sprawdzamy
the
na stronie
date is
szpitala,
set,
co należy
we check
dostarczyć
on the
ze sobą.
website of the hospital
Jednak,
what
w naszym
documents,
szpitalu
what
jest zdecydowanie
records should be
trochę
brought
mniej
with them.
do
Our
dostarczenia
hospital does not have
dokumentacji, właściwie nic
such
czego
huge
więcej dziecko nie
requirements.
musi,
So
przynosić ze
the
sobą, bo,
caretaker does not have to bring
no,
so
tak
many
mamy to
papers with them.
zorganizowane,
That's
że
the way
jesteśmy
we have
pro,
organized
ale
that. We
szpital
are
dziecięcy
pro
też
or
ma
in
jedną
favor
fajną
of.
zaletę, bo
And
posiada
there's
tylko
one advantage
salę
of children's
jednoosobową.
hospital because we only have
Izolacyjne,
single
nie
rooms.
traktujmy je jako izolacyjnych, ale to są
They are not
jednoosobowe sale z
isolating. They're
węzłem
just
sanitarnym.
single room with
Dlatego
sanitary
ten komfort
facilities.
pobytu jest
So
zdecydowanie
the comfort
wyższy
of
w szpitalu.
stay is relatively higher.
Są oczywiście szpitale i
Of
oddziały,
course,
które nie
there are
dysponują takimi
hospital
uprawnieniami,
wards
dlatego
that do not
pielęgniarki
have
powinny
such
mieć
facilities.
na
Therefore,
względzie
nurses
możliwości wyboru
should
sali dla dziecka
always consider
zdecydowanie.
choosing a proper room for a child with deficits. And the medical history should include behavior of the child, customs of the child. It's really important. And if it is possible to select the room, and if you are supposed to put together children in one room or children with parents in double rooms or triple rooms.
Tu duży wpływ ma
But
na to
it is
pielęgniarka, która
the
może wybrać
nurse
salę
that has a big
dla
impact
dziecka.
on selecting the room for a child.
Przykładem mogę podać też,
I could give you
kiedy
some
dziecko jest
examples where a
słabo się
child with
porusza, to,
deficiencies has some walking
sala bez
problems,
węzła sanitarnego.
a room
Dziecko
without
powinno leżeć
sanitary
bliżej
facilities. Well,
Także
then
takie
you should
rozwiązania
put
też
the
powinna
child's
pielęgniarka
bed closer to the door or closer
Diagnozowanie
to the
zaczynamy
sanitary
od
facilities.
przeprowadzonych badań
Diagnosis
fizykalnych i
starts
wywiadu
with
chorobowego.
medical
Badania
history,
fizykalne
physical
są w
testing.
gestii pielęgniarek. Po
Physical testing is
specjalizacji
something that the
mają takie
nurse is
możliwości
responsible
przeprowadzania badań
for.
fizykalnych, ale dzisiaj przed przerwą
However,
wiemy, że te badania to
from
nie
the
podstawowe
information
badania
before the
fizykalne,
break, we
lecz
know
o
that
wiele
testing
rozszerzone
is not
inne
just
ankiety, które
physical
powinny być
testing,
przeprowadzone.
but many
Oczywiście
questionnaires
badania
that should also be
laboratoryjne,
administered.
dodatkowe badań
Of course,
multum, wymieniłam
plus
kilka,
laboratory tests,
EKG, EEG,
EEG, ECG, X-ray, NMR, computer tomography, psychological consultations, dietetic consultations, all kinds of consultations. And of course, we would like to have all this testing conducted or completed over a shortest possible period of time. For that reason, the diagnostic process is really exhaustive. However, the presence of a nurse is of key importance because the nurse prepares the child for testing, very often conducts the testing. She is present during the testing and she monitors life parameters of the child. So there's quite a large number of important tasks for a nurse. A nurse
która komunikuje się z rodzicami,
which is in contact with the parents, she focuses on talking to the family. She listens to the family in an active way, trying to gets information about any changes, which is of key importance in case of genetic diseases. She is observing symptoms. If the child does not understand speech, has problems with communication, some neurological deficits. But what is most important is our nursing sensitivity, experience, systematic approach, and accuracy. A nurse builds a care plan, checks the needs, determines how much time is required for the toilet, how the child responds in difficult situations like during testing, what are the favorite toys, games, and how to prevent some problems or how to help the parents, helps the child with interplay, also watches how the family communicates with the child, how the child functions in a peer group, and of course how the child adapts to a new place. The nurse organizes the child's day in order that the child could benefit from rehabilitation, physical therapy, SI lab, playrooms, and contacts with peers. Maybe the hospital does not offer 24 hours rehabilitation, but there is a playroom, there is a gym available, so stay at the hospital in the afternoon really gives the child a lot of options to use. The nurse decides and helps in the communication between children and parents. What this refers to organizing and controlling or monitoring the meetings between parents and children, sometimes on the corridor. It's important if the nurse takes this risk and try to meet the parents of children with such disease. Of course, she is watching, any findings she makes, she records in the respective file of the child, because all these observations must be later analyzed. No matter where the nurse works, she has a direct contact with the child, with the patient that may have had or has symptoms. It is the nurse who spends most of the time with the patient and who carries out direct observation face to face, can see or is able to see the most dangerous or worrying symptoms. The presence of the nurse at each stage of the disability requires her or his active participation and involvement in the diagnosing process. These are the main needs of the children with the X3X, as we could see here in the corridor. Access to reliable information, including state-of-the-art techniques for diagnosing and treatment, access to specialists and experts. What's the purpose of this meeting? To reach specialists, to reach experts, to know more. Of course, we do not want, or the families do not want to be judged. We want to make people sensitive to the everyday problems the families have, not to limit or not to prevent contacts with peers, and also educate the public about rare diseases. Needs of children with DDX3X involve a bigger awareness to professional needs. It is not just rehabilitation and education, it must be professional rehabilitation and professional education. That is the most important thing, which, as we could hear today, needs of the families and the children is inclusive education, integration group, a lot of facilities in everyday life, like parking,
podstawowe
shops,
utrudnienia.
cinema, offices,
Edukacja w zakresie
education
samopielęgnacji. To
regarding
pielęgniarka jest
self-care.
odpowiedzialna
It is
za
the nurse
zakres
who is
samopielęgnacji.
responsible
To
for the
ona
scope
pomaga,
of
jak oczyścić
self-care.
nos i
It
inne
is the
potrzeby, które
nurse who
powinno
helps
dziecko,
how to clean the nose, for example, how to blow the nose and how to
wytchnieniowej,
sort out
kontaktów z
any
grupami
other
wsparcia
needs
rodziców,
that
pomocy
the
materialnej
child
i
has.
finansowej.
Also has to be
Chciałabym chwilę
sensitive to
powiedzieć o
some
zaawansowanej
financial
praktyce
needs of
pielęgniarskiej.
families. I'd
Nie
like to
chcę
say
za długo
a few words about advanced
zabierać czasu, ale
nursing
też nie czytać
practice.
wszystkiego,
I would
proszę
not
się z tym
take too much
zapoznać.
of your
To,
time. You will
nowe
have the time
wyzwanie,
to read it, but
którym
new
celem
challenges
jest działania, poprawa efektywności
for
systemu ochrony zdrowia,
good
świadczeń,
educated nursing
w tym
personnel
zwiększenie dostępności do
is to
świadczeń. Tworzone będą
improve
zespoły
or increase
interdyscyplinarne, które
access
będą
to
się składać z
healthcare
pracowników
systems and
medycznych
interventions.
i niemedycznych,
Interdisciplinary
różnych
teams are going to be
specjalizacji, w
developed,
tym
consisting of
od
different
lekarzy
medical
różnych specjalizacji,
specialists,
specjalności,
medical
pielęgniarek,
professionals,
psychologów,
doctors,
dietetyków,
nurses,
po
psychologists,
pracowników
physical
socjalnych i
therapists,
terapeutów
dietitians, social
zajęciowych.
workers, and occupational therapists.
Zintegrowana opieka
Integrated care over a
nad
child.
dzieckiem z DDX i innymi
Such
chorobami genetycznymi
integrated
powinna
care
uwzględniać
regarding
branie
child
opieki
with rare
przede
diseases
wszystkim
should
dostęp do
include
lekarzy
first of all
specjalistów.
access to
Jak najkrótszy
specialists
czas
and
pobytu na
experts,
oddziale,
the
jak
shortest
najkrótszy.
possible stay at hospital,
Synchronizowane działania, tak by wykorzystać
synchronized
znieczulenie, na przykład
activities
do rezonansu,
in order to use
do
anesthesia,
pobrania
for
krwi lub
example, to
innych
draw blood,
interwencji
to conduct
powodujących
any
duży
other
stres u
interventions
dziecka.
involving a big
Nieograniczony
stress in the
kontakt z
child.
najbliższymi rodziców
Unrestricted
dziecka,
contacts
dostępność do
with
sali
the loved
sensorycznej
ones,
rehabilitacyjnej,
families,
spotkań
children with
integracyjnych
parents,
z
access
rówieśnikami.
to sensory room and contacts with peers.
Zaawansowana praktyka
Advanced nursing
już działa.
practice
w
has
innych
been in
specjalizacjach,
place
jak
already
kardiologicznych i
regarding other
diabetologicznych. My czekamy
specializations
na
like
zespół
cardiology or
pediatryczny, a w
diabetology.
szczególności na
We are just looking
genetyczny.
forward to pediatricians and
Zaawansowana praktyka
geneticians.
będzie powierzona
Advanced
pielęgniarkom i
practice
położnym po uzyskaniu
Will be
dodatkowych
entrusted to
kwalifikacji,
nurses following
które zostaną
obtaining
zwiększone.
additional
Będą
qualifications and
podejmowane
skills.
decyzje medyczne
Then the
ułatwiające
such
pracę
highly
lekarzom.
qualified nurses will be able to
Genetykowi
take
przede wszystkim.
decisions, will have discretions to take
Jest też
decisions to
alternatywą
facilitate the
dla
work of the
obecnie
doctor, of the
występujących
genetician,
trudności w ochronie zdrowia,
and it is an alternative to the current difficulties in the healthcare system. They make nurses and midwives more active, giving them more discretions, and of course to this end, legislative changes of legislative regulations are going to take place. Advanced nursing practice includes education in the broadest meaning of the word, instructions regarding pharmacotherapy, how the drugs work, whether they can be combined or not, why they were prescribed, knowledge about discontinuing the use of a given drug, access in Poland and abroad, also professional access to personalized or customized rehabilitation and physiotherapy. A patient with undiagnosed rare diseases very often suffers from numerous diseases, numerous conditions. We know there are different problems like heart defects and disturbances of the gastrointestinal system. So the patient may be included in the system from different level, emergency department, hospital, wherever the patient comes, the nurse should always be entitled to ask about his medical history, his difficulties, his symptoms, may help families where they can go to get help or to get advice, and extended knowledge. That is something that is required from any nurse. The nurse must educate because it's important at any stage of treatment. DDX3X. The awareness of the disease is very important also from the perspective of disability certificate, from education of doctors and nurses. highest priority of the EU for the year 2025. Beautiful words to ensure comprehensive, complex, highly specialized, coordinated and innovative medical care and rehabilitation to people with rare diseases. We are looking forward to it. What are our plans for the future? We are saying nurses, we are saying integrated nursing care, guaranteeing 1 day stay at hospital in order to carry out comprehensive laboratory testing under anesthesia, organizing comprehensive physiotherapy care by experienced physical therapists. It is, of course, not only the issue of the nurses, but sponsors, access to genetic diagnostics, to expert or excellence centers, development or emergence of new professions and new specializations, genetical nurse and genetical advisors in oncology. That is one of our purposes also, of our targets.
Professor Anna Latos-Bieleńska
Professor Anna Latos-Bieleńska is a great advocate of genetic nursing specializations, because this will definitely accelerate the process of diagnosing patients with rare diseases, including, of course, the X3X. And they could greatly contribute to the teams of geneticians. Here you can see Professor Latos-Bieleńska. She is really a great advocate of genetic nursing. She has great contacts with nursing teams. We've had a lot of discussions with different people trying to conclude the process as soon as possible. And that's our charge. Thank you very much for your attention.
Dziękuję. Do I see any questions? That's okay. If you'd like to ask some questions, then there will be some chance later on as well. I did want to mention that this is the first time DDX3X related conference has a speaker from this angle. So this is the District Nursing and Midwifery Council. This is the first time ever that a conference like this has this topic covered.